Welcome to VBF Facebook Live with Dr. 𝗧cie𝗽𝗁. You won't be able to see anything other than me. I don't know if you can see questions, Dr. 𝗧cie𝗽𝗁.
No,
I
I
can't.
cannot. I only
Okay,
see you.
so I do see everything on here, so I can read it to you. You are live, thank you. It's something wonky where I'm not seeing any of the questions here in the platform that I'm in. So I see Allison Gildov's on, Emily's on. Hi, Emily. Abby Miller, Shamal is on. Kiana, hi, Kiana. Abby, okay. Yasmin, and I also commented that we're on. So welcome to VBF Facebook Live. We used StreamYard last month and that didn't work. Now we're doing VBF Facebook and using the Zoom, and I tested it and it worked beautiful, but this time it's acting up again. So we apologize. We apologize always for technical difficulties. So tell us all that are on. I see a bunch of you are on. Tell us where you're from and what is your question for Dr. 𝗧cie𝗽𝗁. And remember, we can't see you, so give a good description. If you're talking about your child, say it's a flat red birthmark, it appeared at birth, or if you know it's a port wine, how many laser treatments you have, how old they are, any recent changes, because Dr. 𝗧cie𝗽𝗁 can only go by what you're asking on here, and he can't see. So you have to describe it enough so that he knows what you're talking about. Hello, everybody. We're ready to take your questions. While they start typing and asking their questions, Dr. 𝗧cie𝗽𝗁, hurrah, hurrah, you finally got the Pro, the V-Beam Pro from Candela. How long have you been waiting for that? Like 2 years?
Well, we've been waiting for it. Well, the order went in June of 2025. It was supposed to be delivered in December of 2025. And then the company had an issue with their hand pieces, so they paused production. And then finally they solved that problem with their hand pieces. And then the device was installed, arrived at Beckman on March 31st of this year, was installed the next day, and my fellow and I started treating the next day. So,
And what's your take on it?
well, it's a absolutely beautifully designed device. It has a number of big advantages, which I think are going to be helpful. Number one, it has more energy, which means we can deliver a higher energy density over a larger spot size. And what that means from an engineering sort of optics point of view is that the larger spot sizes, if you can use them with higher energy densities, you're going to have more light deeper into the skin. You're going to have a more effective energy density below the skin surface. And therefore, this is, I think, going to be a big improvement over what we've had in the past, where the energy densities I could only use on a 12 millimeter spot, I can now use on a 15 millimeter spot. And so if you think about, well, that's, pi r squared, you're going from 100, an area of 144 millimeters to 225 millimeters squared. So you're going to a much larger surface area.
So
So,
what is that? 40% faster?
oh yeah, it's a lot faster in the OR. Last Friday, I did two kids with large extremity lesions, and we were able to do them in about 20, 25 minutes, whereas we had budgeted based previously, 45 to 50 minutes. So it's tremendously much faster. So, and again, with that larger spot size, for kids who are undergoing general anesthesia procedures, this, is definitely going to be very, very helpful in terms of minimizing their anesthetic exposure, which is what we're obviously trying to do in these kids.
So we have our first question from Emily. Hi, Dr. Linda. Emily and Levi from Wales, UK. We remember seeing you. My son has a segmental right-sided facial hemangioma. He's really involved and he's got it very big around his orbit area. They've been at Ormond, Great Ormond Street Hospital, for treatment. And does this, so now he's 3. wait a minute. Okay, my son has a segmental right-sided facial hemangioma and intraorbital periorbital hemangioma. We are now under Great Ormond Street, and they've mentioned laser for my son at about when he reaches age 3. Does this sound like a good idea? My son is currently 7 months, and although being on max dose of propranolol, which didn't work, now atenolol and prednisolone, which I recommended, because he was not responding, I gave them info with Dr. Cohen about using steroids. So what Dr. Cohen does is he lowers the beta blocker and introduces steroids on treatment-resistant hemangiomas, and it's been working. And we are noticing no change to the redness, only a slight decrease in the swelling. So I've seen this little boy, would you do any laser on it? I mean, it's still pretty puffy.
Well, I have a child very similar that was referred to me from San Diego of a diagnosis of port Weinstein. And the child clearly had a segmental hemangioma. The child was admitted, worked up for 𝗧cie syndrome, did have more the two components, so does have a diagnosis of 𝗧cie syndrome, did have the intraorbital involvement. That child was started on propranolol and did respond very well to propranolol. But this child is now probably about 4 or 5 months old, and I've done 2 laser treatments already on that child, and the cutaneous component of that hemangioma is pretty close to resolving. The other thing that I can tell that mother is that the child, unfortunately, because of the delay in diagnosis, had some ulcerations and had several areas of scarring. And so the PDL, we know, generates new collagen formation in the skin. And so this child had 2 depressed scars over the right lateral sort of temple area, and those have almost resolved completely with the 2 laser treatments. So I would encourage them to proceed with the laser treatment now. But I haven't seen the photograph, but that is what I would do. And as I said, that's what I did do with this child here in Southern California, who's probably now 3, 4, 5 years old. They've just had their second laser treatment. And in fact, I think they're coming back to see me next week or the following week before I go on vacation.
Awesome. Well, that's good advice for Emily. Jasmine says, hello from Western Oklahoma. Do you have any experience with AVMs? My husband is 35 and has had it where it's basically on the right side of his chest, front, back, down to almost his elbow. He's had about 100 embolizations. I can answer this. So Dr. Nelson does not treat these kind of complex AVMs. But if you come to our super clinic in New York, Jasmine, with your husband, Dr. 𝗧cie is there with the ultrasound. We're doing free ultrasounds, and he has patented now a treatment for AVMs that is absolutely blowing any prior treatments out of the water. Like literally after treatment, there's no evidence of disease. So Yasmin, go to our website at birthmark.org and scroll down, and you will see the New York City Super Clinic. Sign up for that, and you'll get a free hotel. You could see Dr. Nelson, Dr. 𝗔𝗯𝘂, Dr. 𝗧cie. We do dental, we do orthopedic exams, we do AVMs, venous malformations, ultrasound. So please take a look at our website at birthmark.org and consider coming with your husband. I don't even know that you have anybody treating AVMs there, do you?
I mean, with high flow AVMs just don't respond well to laser. I mean,
Right.
the blood flow is just too high. In fact, I have another patient here in Southern California who's got a very complex upper extremity, high flow AVM, multiple lesions, has had multiple embolizations, has had resections by plastic hand surgeons who I'm trying to get to come to the clinic as well. So I need you to save a spot for her as well.
We
With
will.
Bob Rosen and 𝗧cie. So I'm seeing her next month too. I'm trying to get her to come.
Yeah, there's a woman that I referred to you who has an AVM in her arm, but I referred her to you because she's from Kaiser, so you would tell her to come to our conference.
No, she's not from Kaiser. This
No,
person has
this one's
a
from San
regular
Diego.
PPO. Oh,
It's,
that one I don't know.
she's gonna come to see you. So Allison is calling in from Australia. Hi, Allison. My daughter, who is almost 16, has a port wine on her cheek and lip. She's had 25 to 30 treatments until the age of 3. Right now, she's 16. She recently started again and has had 2 sessions with the Perfecta. In the last 10 weeks, she has done some thickening and some bleeding. She's aiming for 4 lasers this year and then once a year for maintenance. Does that sound like a good plan? She's with me right now and also asking if little raised dark bumps within the laser spot a few days after it's been done is normal.
Well, the reason I would suspect that her port wine stain is getting worse is that she's 16 years old. She's probably just finished going through puberty. We know all vascular malformations get worse during puberty because of the changes in the hormonal status. I would probably be a little bit more aggressive with that. I would probably treat that child every 2 to 3 months until I got the maximum fading. And then perhaps I might start waiting maybe 6 months to a year. But the comment of you said there was bleeding from
Dark
bumps.
bumps that sound like little pyogenic granulomas or vascular blebs.
Well, is the bleeding before the laser treatment or after the laser treatment? I'm sorry, I didn't understand
She
what you
said,
said.
she's with me right now asking if little raised dark bumps within the laser spot a few days after it's been done is normal. So that doesn't,
No, it
unless,
does not. That does not sound normal. And that does
but
not sound like a pyogenic granuloma, which are usually raised lesions and they are bright red. But no, you do not want to have raised areas inside the treated exposure areas after the laser
she
treatment.
should get an ultrasound because that could be CMAVM.
That could be potentially.
So, yeah. So I would get an ultrasound. That's what I would do, Allison. Find somebody that can give you a good ultrasound. We're offering an ultrasound free clinic in Bucharest, and also Dr. Nelson will be there doing free laser. That's in July, everybody. You can see it on our website where all of our free clinics are, where we do free laser at every single clinic. So please check us out and know that you can get an accurate diagnosis when you come to our events. So we have a lot on, Afton's on, Lois Henry Whitehead. Hi, Lois. Allison Gildove says, I mean, thickening and bleeding over the last few years, which are her reason for restarting. No bleeding since the laser. It's been over the last few years.
So it's
So they
before the laser exposure.
right.
So
So
she
they
probably has vascular nodules.
right.
Although, without looking at a picture, you're right. It could be pyogenic granulomas, which, depending on how thick they are, could be treated with the laser during the treatment of her port wine stain. If they're nodules, they can certainly be treated, during the time of the laser exposure with either longer pulse widths of the laser and higher energy densities, or if they've got, they don't, they've said they had a perfecta. If they were to see someone who had a prima or a pro, they could treat those spots with the YAG, and that would flatten and smoothen them out in a single treatment.
Right. And so, the other thing is, like I said, we have these free laser clinics and we offer all of that. But also, Kiana's on. So, Kiana, would you please put Dr. Nelson's email in the chat so she can send pictures to him so he can, assess if they are vascular blebs or pyogenic granulomas or something else going on. But the ultrasound will also help to determine if these lesions are high flow and this may be something else. But it's important to get an accurate workup. That's the most important thing. But thank you for clarifying that, Allison. That's why we tell everybody on here, you got to give us good details and in proper sequence so we can answer. Shamal says, thank you for this talk. We traveled to Irvine for my daughter's treatment. So Dr. Nelson's familiar with Maher Shah. I don't have any questions, but glad to hear about the Candela Pro. So that's one of your daughter, her daughter is 𝗬𝗂𝘂𝘁𝗄𝗏 𝗧,
Well, I know exactly who it is, but due to HIPAA, I'm not going to say yes or no to anything.
Oh, okay,
Whether
well,
I know who that child is, but I know who that child is.
right, so she's happy to hear you have the pro. I'm assuming she'll be a candidate. So
Yes,
that's
she
all,
will.
that's all good. James Phillips Cole, good evening from London, Ontario, Canada area. My 6-year-old has port wine on the left side of his face, covering 40% of his face. The treatment seems to be improving. I'm wondering if this will be a lifelong thing, and will it thicken, harden if treated with laser? He has had about 8 treatments already and will continue for a bit still.
Well, what we know is the laser will significantly decrease the chances for developing hypertrophy and thickening of the lesion. So that she should definitely continue with. But depending on where this laser is in the V2 dermatome that they're talking about, the upper lip and some of the other areas may be more resistant to the laser treatment, and they may have to, come in once or twice a year, at least as we sit here April 27th, 2026, with the technologies that we have available. But there's lots of things we can do. We can change the pulse durations of the laser exposure, during over an extended treatment protocol. And we, Roy, and others have found that to be very, very helpful to do that.
Thank you for that. And Kiana, I'm not sure if you heard, but can you please put Dr. Nelson's email in the chat? I believe it's J.S.
What's
Nelson.
on your website? Just have them go to your website, to
Yeah,
your
but
expert
if
panel.
we put it in the chat, it just makes it easier for a lot of people. Hi Donna, hi Shamal, hi Amanda, hi James. We're ready to take your questions. I will be with Dr. Nelson and Dr. 𝗧𝗃𝗁 for doing the ultrasounds in Bucharest in July. So we still have some openings, though it's a very packed clinic. It's our only European clinic that we'll be doing this year. We also have the clinic in New York City where Dr. Nelson will be lasering, and that is filling up very fast, especially because of Dr. 𝗧𝗃𝗁 with his success with the electrosclerotherapy and his 2 modifications. So now we have a lot of patients coming to meet with Dr. 𝗧𝗁, which is all good. So while we still have 33 minutes with Dr. Nelson, we enjoy your questions. We like learning from you. We want to hear any questions you have. He's already spoke a little for any of you who got on late. He basically said the new Candela V-Beam Pro is quicker, goes deeper, gets more clearance, and is less painful. That's what we've heard, at least.
No, that's very true. That was one of the first things I did since I invented the dynamic cooling device. I will give Candela credit. That was definitely improved. For one of the first things I did once we got it operational was to lay down a couple of spots, and I could barely feel it because you can add that post cooling. And I told you the next day, my fellow and I treated several patients. And the first patient was a young lady who has, chronic rosacea that inflames. She comes to Beckman 3 or 4 times a year. And my fellow treated her. And without even prompting from us, she said, the treatment hurts a lot less. What is different? And the difference is that the cooling spray is much more effectively delivered. You need less of it. And then you can also add the post-cooling spray, which also helps to numb the skin.
So
So,
at the laser guidelines meeting we had in Marlborough with all of you guys and Roxy Anderson and the team was there with Jeff. And I said, look, I'm going to give you a summary of the 2 things patients want. They want more clearance and less pain. And they added the cooling pre and the cooling post, which I had said to you, cool zap cool. And that's what it is. And it is effective. And
It should have
actually,
been. I mean,
when you
it's
think
in our
about it,
original patent description post cooling. So
really, so I mean, they should really be using that cooling with everything pre and post, everything. It's only
well, it's,
gonna,
I don't use it when the children are under anesthesia.
well, of
It's not
course,
going to benefit there.
right.
But if
But
you're
I
doing
mean,
cosmetic procedures or when
right.
I do it with the kids as an office-based procedure, then we will add the post-cooling spurt to try and minimize the pain exposure as much as possible.
Okay.
And it definitely helps.
So this is a good question. How do you know when you've reached maximum lightning?
Well, I'll tell the parents if we've done probably maybe 3 treatments in a row. I think, it's time to take a break because, we just want to, see where things are going to go. Also, particularly if these are children, what we've seen, they evolve, their hormonal status changes, they go through growth spurts, they do all of these different metabolic things. Their port wine stages changes. And some of these kids, after you take a break and you come back, the biology of that malformation has changed. And many times you now can actually treat it more successfully if you've given it a break as opposed to just keep going and going and going. And I have several patients that in the last year where we've done this, and then when they've come back, they've had much more, successful clearance after. And I'm talking about young kids between the ages of 2 and 5. I'm not talking about infants. I'm not talking about older patients, but definitely younger children. That can be very helpful.
Excellent. Eliza says, oh, the name of the laser that someone asked is called the Candela V-Beam Pro. That is the newest laser. That's the one that Dr. Nelson's talking about. Bigger, better, deeper, faster, less painful. Eliza said, I've used the Pro 5 times now. It's so great that now the most painful part is the eye shield, but the eye shield is really painful, and I worry about it hitting my 40-year-old trabeculotomy. Are there any alternatives to shields?
Well, if she's had a trabeculotomy, that means she's got glaucoma. So she needs that shield so that we don't damage her either trabecular plast. I don't know. She's got a valve in there or some kind of a shunt, but she needs to have that metallic contact lens into the orbit. But it should not be painful. I mean, she should ask her physician, I don't know whether you can see this on
Yeah,
the screen, but proparacaine hydrochloride, if I
right.
hold
So
that up
that's
high enough.
actually a beta blocker like timolol, and it's right.
And you can put this into the orbit. In fact, I was going to bring a couple of bottles of with me to Bucharest.
Do that because that's the numbing agent, right?
That's the numbing. 1 or 2 drops of that. You should not be. It should not be uncomfortable. And then putting a lubricant into the lens before you actually insert it into the orbit, it should not be uncomfortable. And plus, maybe the person doing it, just doesn't have a lot of experience doing it. I mean, what I would tell them is you always ask your physician to put the shield going upwards, towards your upper eyelid. Your oculoplastic surgery colleagues will tell you there's much more area above the upper eyelid than there is the lower eyelid. The tendency is to pull down and then put it in. No, go towards the up. There's much more room and it's a lot easier to put the eye shield in.
We did do a demo on that with Roy and put it on the ASLMS website, but we should recycle that demo again. Of
I think I told you I've got a video of a young kid. He's just, he was like 5 or 6. I just saw him. He'll just lie down on the bed. We put a drop in and put the eye shield in. And we do his laser treatment.
I'd love that if the parents would give us permission to use it to show
Sure. The
how it's
mother is a
done.
nurse. She totally understands all of this.
Find that out for us. That's great. Um, Eliza said it's Roy. Oh, yes, a bleb. And yes, it's numbed, but my limbic system fights my doctor. Her limbic system fights Roy. Can't do anything about that, Eliza. Roy's the best. So that's he's one of the best.
Well, just
Um,
maybe wait a little longer, put the proparacaine in and wait, wait a couple of minutes. But make sure you get a big gob of the lubricant on top of that lens and dump it into the orbit. It's 2 things. It's the topical anesthetic and it's the lubricant. You need both before that shield goes in.
James, if they got their laser in December of 2024, it's possible they got the Pro, but
No, no,
not, no, yeah, okay.
no. I mean, they're just delivering. I think ours was the eighth one installed, the engineer told me.
We have a list of the first four, which was Friedman, Bernstein, and
And Roy
Jersey,
and
Roy, and the
one of the
guy in North Carolina.
Gary Manavili. So I mean,
Yeah.
I mean,
Well, no, Friedman has it now, and you have it now, and Leonard Bernstein has it now.
yeah. Well, that I don't know, but I know our system was the eighth installed in the U.S.
That makes sense because there's one then that was installed that I don't know about that I've got to find out about because I'm trying to keep the list.
Oh, it's Oranger in Michigan.
Oh, okay. He got one?
Yes.
Okay. Well, that's good because they have all those patients in Michigan. All right, so we can take more of your questions. This is from me, have you used the Pro on an infantile hemangioma?
Yes, I treated that child who I told you about who had the 𝗧cie syndrome with the Pro.
And did you notice a difference?
Well, yeah, there was dramatic lightening of the hemangioma. That's why I encouraged the family that was, where were they from? I think was it Australia that family called that said that they had,
Yes.
I would encourage, or no, they went to Ormond Street. So it was Britain.
UK,
It was
UK.
Britain. It was Britain. So I would encourage them to definitely get the laser treatment. But yes, I have used the Pro. Yes. And I'm going to use it on that child again next week before Peggy and I go on vacation.
But they don't have the Pro in the UK. Are you saying this Pro on a hemangioma does better than the Perfecta?
Well, I think it does based on what I've seen at this point. But if they don't have that device, I know the first couple of treatments I did, with all the other kids with 𝗧cie syndrome and this telangiectatic matting and redness, I treated them with the Perfecta or the Prima, and you still get very good results.
Do you still have, oh, hi. No, Anna Duarte does not have one yet. She's still waiting for hers to be delivered.
Well,
But
the
she,
problem is that Candela is only making about 5 of these a month. That is their engineering capacity. So, I saw he sort of showed me they've already got like 50, 60 orders. It's going to take them almost a year to fill all of the orders that they have based
well,
on their current production.
and I can tell you that the patients that have come to the New York City clinic that have used the Pro, and now we have that you've used the Pro, so you and Leonard and Roy can all be using the Pro at our clinic as well. Now that we have more and more doctors using the Pro, we have more patients reporting how much less painful it is and how patients who haven't gotten treatment for 10 years because they said it was torture are now coming back because they say the Pro is tolerable without, like Roy doesn't, in some cases doesn't even use numbing.
Well, I will always offer it. I mean, these are
Yeah.
repeat. It's an easy thing to do. I mean, if somebody's got, these V2 dermatomal port wine stains, it's easy to do an infraorbital nerve block and then on the lip. I want patients to be comfortable because they do have to have repeated treatments. So we offer them topical anesthetics. We offer them regional nerve blocks. We offer them a combination of the same. In fact, while you asked me to sign on, I was just finishing a chart of a young woman who I saw, a 40-year-old, who told, had last had a treatment in 2003, not with me, with somebody up in Los Angeles. The reason she stopped was because it was so painful. And I said, well, we'll put in a regional nerve block, no problem.
So Susie Cross says, "Where are you, Dr. Nelson? I'm 60 and and it will probably really make a difference for me. Facial, full left side port wine stain." So he's at the Beckman Laser Institute in Irvine, California, which is Southern California, not too far from the Los Angeles, LAX, but close to John Wayne Airport. And
Yeah.
many people travel from all over the world to see Dr. Nelson. A lot from Canada, Oregon, Utah, correct?
Mexico, we have a lot from Mexico.
Mexico. So you can find his information on our website. under our Ask the Expert, or if you scroll above, Kiana posted his email and he can put you in contact with his practice manager. So Rebecca says, my daughter has multiple vascular malformations on her body, including one from her buttocks to her calf, on her hymen, deep into her vagina, as well as in her rectum. She is 8. As she gets older, what age would be appropriate to dig deeper to find out what type of malformation it is? I'm thinking more puberty, childbirth. Well, I'm going to tell you right now, you should really, Rebecca, we don't know where you're calling from. We asked in the beginning, anybody coming on, let us know where you're from, because that helps us to know who to refer you to. You really need to come to our clinic if you can get to New York, where Dr. 𝗧cie will be doing the free ultrasounds. You need to know if this is KTS.
That would be my first thought, KTS.
Right, or it could be FAVA, fibroadipose vascular anomaly. It could be a port wine with overgrowth, but you really need to know what it is, especially because it's so invasive in her perianal area. So you really want to come to one of our clinics where Dr. 𝗧cie will be doing ultrasound, which is New York in October and July in Bucharest. Not sure where you are, but those are the two options. And getting an accurate diagnosis should not wait. You should get it done now. It's very important to know what it is, and if you've got the MRI, you can send that along and have, Dr. 𝗧cie, you can bring it to New York or have one of our experts look at it. You can see Dr. 𝗦𝘁𝘂 and Dr. Rosen in New York City as well. They'll be at our super clinic. You're never going to get more experts, right, Dr. Nelson, in one clinic for free, seeing so many patients. It's like unbelievable. Wouldn't you agree what we offer, Dr. Nelson, at these
But
clinics?
not only an MRI, most importantly, an MRA as well. MRI means imaging, MRA means angiogram. I mean, you want to see what this vascular, you want to see the vasculature. So usually when we order these, we order both an MRI and an MRA. And I would include the pelvis. And I don't remember which extremity she used. I think it was the right side. I would probably image her entire right lower extremity. But
Dr.
definitely the
Yeah,
pelvis.
but also if Dr. 𝗧cie does the ultrasound and it's dominant venous, we know what it is. If it shows up dominant arterial, at least we know whether it's venous, lymphatic, arterial, or mixed. And then, so in the meantime, she can get the MRA. She can
Yeah,
get an
that'll tell you
MRI.
all of that too.
Yeah. But you do need good imaging, you're right. But you can come to our super clinic and conference and at least get the best consultation you'll ever have. I had laser every 5 years, tried the Pro at Linda's clinic, VBF clinic, and now have done treatment every 6 weeks, 5 times so far. That's great, Eliza. I hope you're seeing great improvement. I remember you, so I hope you see great improvement. Rebecca said we see Boston Children's Vascular Anomalies Clinic yearly. Okay. Oh, so you're in Vermont. All right. Well, you can come to our super clinic because New York City's not that far, and you'll get a free hotel room. Nobody else does that. Rooms are almost $500 now. And we raise money all year long so patients can have free parking, free ultrasound, free laser, free hotel, free consultations with up to 6, 7 doctors, all doctors pertaining to vascular anomaly, top experts. So I hope that you will consider coming, Rebecca, because I think it'll be a very informative session for you and your family to get this information. So we still have 17 minutes for Dr. Nelson to answer your questions. So Dr. Nelson, I have one before people start jumping on. Tell me with all of them that you've done so far, all the pro treatments, I'm assuming you've probably done 20, 30 by now since you've had it, right?
Easily. We've done a couple of people to many people twice.
Then what are you seeing or not seeing regarding purpura?
Much less purpura. In fact, one mother who I've been taking care of their child who has a large extremity lesion actually asked me, I mean, there was just maybe, this child is, maybe now 8 years old, treating the whole extremity, she may have had maybe 30 spots of purpura, whereas in the past, the whole arm would be purpuric. I mean, one of the things Candela did deliberately was to change the orientation of the micropulses within the 1.5 millisecond pulse. They stretched them out. And as a result of that, when the 1.5 millisecond pulse is used, you're going to get a lot less purpura. You're going to still get purpura at the 0.5 millisecond, but not as much. But definitely at the 1.5 millisecond, it's dramatically less.
That's amazing because, we keep all the moms are always saying, "Oh, I didn't see any purpura. I need to switch doctors." Not if they're using the pro.
No, with just what, first of all, in fact, that woman I told you about from LA today, she said to me, I had one treatment and I thought that the laser didn't work. And I asked her, well, what pulse duration? That's the question. You send me email from people. I had a laser treatment yesterday. My son had a laser treatment yesterday. There's no bruising. The laser didn't work. So the first question is, what's the pulse duration? And I said to this woman today, if you want to be bruised, we'll do the 0.5 millisecond pulse duration. You will be bruised. If you don't want to be bruised, we'll use 1.5 and longer, and that will minimize the bruising. So the bruising has to do with what the pulse duration is used, not whether or not the treatment was effective.
And also, what's the end point, whether you bruise or not? Isn't it the same?
Well, the end point is you're going to see sort of a gray ash discoloration. It's very slight, but you're not going to see this purple discoloration that looks, very, is cosmetically unacceptable, to a lot of patients, unfortunately.
Right, and we thought that when we found out from Candela that there'd be less purpura, we thought people would be really happy, but they keep thinking it means it's not effective. And then there's other people using older lasers that aren't getting purpura, and they're saying, well, but that was not. So it's a real learning curve with the pro with
It
less.
just depends on what pulse duration is used.
Right.
Well, that determines whether or not there's purpura.
So Erica has another question for you. She said, you spoke about when to stop laser treatments for older children, but when do you stop for a kid under 1? My daughter is 6 months old, has a port wine on her cheek, eyelid, eyebrow, and temple. We see Dr. G with the pro, but the process is so easy, I'm almost afraid to stop. She smiles right after. We did 2 to 3 weeks, 5 days in a row. So they were in our 5. That was our project. That was mine and Roy's 5 and 5. 5 consecutive days, do a laser treatment. Then switch to weekly. The eyebrow is slower. Overall, 90 to 95% clearance. Please send me pictures.
That's what you want. You want to start treating those. I think the fact that the child is treated younger, that's the most important thing. I'm not sure about the 5 treatments in 5 days, but definitely the fact you need to treat these kids as young as possible.
Well, Roy presented on it at the AAD meeting, the 5 and 5, and he might be presenting at the ASLMS, which you'll be there, right, next week?
Yeah.
I'll be there as well. Kiana, please post my email in there, vbfpresident@gmail.com, Erica 𝗧cie�57𝗂𝗂, okay. Could you please send me the pictures because that's very important for me with consent, if I can share how the 5 and 5 and how you've gotten 95% clearance when she's only 6 months old. That's like amazing. That's miraculous. What have you maintenance to be for kids who has done? Oh, are you doing any weeklies?
Yes. I mean,
Okay.
particularly if the family lives in Southern California, or within Orange County, Los Angeles County, we try and do them as much as possible.
Are you do you have any of those in maintenance? Like, do they go into maintenance and then what is it? Do you just wait for the stain to recanalize or do you put them on a schedule?
We put them on a schedule where we treat them as aggressively as possible, and I tell the family for the first 4 to 6 months. We try and be as aggressive as possible, and then we'll take a break. And then we'll see what happens. Is there going to be some slight recurrence? And I tell them, come back in 3 to 6 months and we'll see there where we are. But you want to do as much as you can when the child is younger. There's a number of optical advantages to doing that. The children have less melanin in their skin, which means that the skin is more transparent. The vessels are smaller, so they're an easier target for the laser to destroy. Kids have less normal collagen in their skins, therefore more light goes deeper. So there's a whole number of optical advantages to treating infants and young children as opposed to treating somebody who's older or an adult.
Good to know. So Eliza has another question. The Pro has lightened my cheek a lot and uncovered one tiny spot that isn't lightening, like all the skin around it. It's not raised, just curious. That probably is something that the laser just can't reach, right?
Or that may be an area where the blood vessels are larger. I mean, we did a study, 20 years ago. It was published where, we took a bunch of biopsies, and even with the port, it's the same patient and the same port wine stain, blood vessels can be over a wide range of diameters. It may be that this spot just needs to be treated with a much longer pulse duration to see more clearance. So that's what I would do, would be to change the pulse duration of the laser exposure, which I'm sure Roy will do.
Kristen says lasers have changed a lot. I used to be burned in the 90s. The one I experienced at your DC event had amazing low side effects. And that was with Dr. 𝗃𝗃𝗃, who was trained by
Paul.
Dr. Friedman, who was trained by Roy, and she is exceptional. She has another clinic coming up there, a free laser clinic, June 26th. So there's a lot of opportunities for all of you to get free laser through VBF. We had the clinic in February in Miami. A lot of people didn't take advantage of it. We have one coming up in Bucharest, Europe, and then we have New York City, and we also have one in DC. That's all, no ultrasound, just laser, but she's exceptional. And that's June 26th. So that'll be posted on our website soon. Write a note to yourself, put it in your cell phone to remind yourself to go look at it, because we should be launching it any day, but it's not launched yet.
My wife Peggy wants to know why you're not haven't had a clinic yet in Paris, since we're doing all of these trips to Europe for VBF. Why haven't we
So
done a clinic in Paris?
I just reached out to Laurent, who's part of our VBF experts, to see if he would host one in Paris. We have, there's a possibility next year, believe it or not, we may be going back to Greece with Stavros and doing a clinic. And Roy wants to go, so he loves Greece.
Well, as I told you, either mid to late June or early September.
Right.
And I'd like to know those dates as soon as possible because
It'll likely be late June, but so it was between Spain and Greece, and again in Paris it has to be somebody that has a private practice. That's the only way it works for us, especially with all these European doctors. We can't do the hospitals or their big established clinics, because then they take years to get anybody, licensed to treat. So we do private practices. So hopefully we'll either be back in Greece, or we'll be back in Italy, or we'll be in Spain or someplace else. But we are working on it. I did have a massive request from a group of people asking us to go to Japan, which isn't Henry Chan there?
no, Henry's in Hong Kong, but in Japan you've got Taro Kono,
Taro
who's a good
Kono.
friend of mine and also a good friend of Harry Chan's who we could approach,
You
So
think
Taro's very good.
You think he'll be at the ASLMS?
Yes. But Henry will definitely be there. I'm having dinner with him one night.
So
So
we should talk to them about having a free clinic in Asia. We really should.
yeah.
That might be our next one. So James wants to know, what's the biggest advantage of the Pro compared to a laser 1.5 years ago?
Well, the advantage of the Pro is that the device delivers more energy. Therefore, you can use much larger spot sizes when you do the exposure. And it's a basic principle of optics that the larger the spot you use, if you're using the same dosage of light, you will get a higher energy density underneath the skin. You'll get more light deeper into the skin when you're using the larger spot sizes. So that's the big advantage of the Pro, is that the device is more powerful. Therefore, you can distribute that energy over a much larger, not only area, but also you can have a more effective energy density underneath the surface of the skin.
Abby Miller, the Miller family from Las Vegas, just wanted to say thank you, Dr. Nelson, for all of his amazing help with our infant son. That's Abby Miller and the Miller family.
I know exactly who that is too.
All right, and due to HIPAA, he is not responding other than saying, I know who that
Well,
is.
you're not supposed to be using names.
They're on here and they're posted for us to share.
Okay.
So because it's on a public forum and the family shares their own name, it gives us permission. So it's all good.
Fine. You
Yeah, so Abby says hi and thank you, Dr. Nelson.
happy to do it.
No, the V-Beam Pro is not yet in DC, Susie. Like Dr. Nelson said, it's only in 8 places. It's usually the top treatment specialists or people who can beg really good. It's not cheap either, right, Dr. Nelson?
No, it's almost $180,000. I mean,
Yeah, I
it's
thought it
not,
was 179 or
well,
something.
then you add the taxes, the shipping, the delivery, I
Right.
mean, it's almost $200,000. So, you know, it's not, it's expensive. But the big problem right now is it's just the production. They're only able to make about 5 of them a month. That's what their chief engineer, who actually installed our device at my request, told me we can only build about 5 of these a month. So it's
Wow.
going to, and they've got already 50 to 60 orders. So it's going to take them a year just to fill that.
So did he come from Marlborough, Mass?
Yeah, you met him. In fact, I met him at your VBF.
Right.
I'll tell you his name is Teddy. He was at
Okay.
the conferences. He
Right.
is the chief engineer on this project. And he and I have had a good relationship. And he said, look, I'll come out and install this device for you. Number one, because I want to install it for you. And number two, he wanted to train several of the other Candela field service engineers on how to install these devices.
Oh, that
So
was great. That was
it actually worked out great for me because not only did I
win-win.
watch the installation, I watched him actually teaching these guys how to do the installation. So we were there about 6 hours together. I sent you a picture. Didn't I send you a picture? I thought
Yes,
you,
but did you record it so you would have it too? Do you have
no, we
any?
did not record it. We did not record it.
Okay. Well, I'm going to be recording ultrasounds because we're going to be creating a curriculum for ultrasounds for diagnosing vascular lesions. So I think from now on, when things like that happen, we need to try to remember to record them because then you can go back and look at it when you see the installation. If it gets unplugged and has to be moved and it's got to be reinstalled, hopefully not. 𝗧cie Campos is saying hi. 𝗧cie. She's friends with Marty. I think she might even be a relative of Marty Mims. Elida Silva is saying hi, Dr. Nelson. Hi, Diane. Hi, Elida. 𝗧cie.
Tell
Um,
Elida my best regards to her and her 3 sons.
she's hearing you. She can hear you. James Phillips Coles is watching. So we still have some time. We got a couple minutes. Remember, Dr. Nelson has the pro. You do accept most insurances, or do they have to be in California?
No, we have people from all over the U.S. I mean, we have a lot of, people, employees who work for, work in Southern California, whose insurance is, Blue Cross Blue Shield Illinois, Blue Cross Blue Shield of Texas, Blue Cross Blue Shield of, it depends on where the home company is. If they're an employee of Bank of America, it's Blue Cross Blue Shield North Carolina because Charlotte, North Carolina, is the head of where Bank of America is. If they're a Boeing employee, which we have a lot of Boeing employees in Southern California, they have Blue Cross Blue Shield of Illinois because that's where the Boeing headquarters are. Boeing moved their headquarters from Seattle to Chicago, about 10 years ago.
Are
So
you guys accepting Medicaid or Medicare?
no, the university doesn't accept that for these procedures.
Okay, hopefully someday that will change. So one
Some
final,
Medicare, yes, depending on the circumstances. So some
okay,
Medicare, yes.
okay. Now, for early emerging infantile hemangiomas, are you still doing that 1-2 with the topical timolol and lasering?
Absolutely, absolutely. That I found that to be a tremendous winner. Start the children on, these lesions are on the face, many of them are around the eye. Timolol's been used to treat, pediatric glaucoma for 50 years. So if you get it in the eye, it's not a problem. But that has been a wonderful addition to the things that we can do.
That's
And they
awesome.
work synergistically. It's been shown that if you use the laser and the beta blocker together, you can reduce by 50% the amount of time the child needs to be on the beta blocker.
But remember, that's only for infantile hemangiomas, not port Weinstein's.
No, it
Because,
only can be used for hemangiomas.
right, I don't want people to take that out of context and then,
No, I
start,
get that question occasionally during consultations.
yeah.
Can I be treated with propranolol? And unfortunately, no, this is a totally different biological lesion.
So, Dr. Nelson, any words to add as we close, like anything new that we'll be seeing at the ASLMS regarding lasers or anything new?
Well, I'm sure the device will be there. I'm not sure if I haven't looked at the program yet because it's still a week away. If there'll be any talks about, the Pro, because I mean, there was 4 beta testing sites and now they've just started to get them into the field. So we really haven't had, what you need is a number of experienced investigators, doing randomized clinical studies, at multiple different participating institutions so you can see what the results of this new treatment really is going to be and what its impact will be.
One quick question, is genetic testing recommended?
Depends on what the lesion is. I mean, I wouldn't say for 𝗧dige-Weber syndrome, but certainly the 𝗃3-𝗃CA for KT syndrome. Sometimes we'll definitely, if there's a lot of limb overgrowth, we will do that. The problem is if many of these testing is that there's only 1 or 2 places in the United States that can
That's it.
actually run the test. The
That's right.
principal one being WashU in St. Louis.
That's right. Wash you.
And it's a very difficult test. I went to a talk about somebody gave at the Society of Investigative Dermatology. This guy from Stanford, he actually had to biopsy the lesion 3 times. He was so sure that this patient would have a positive result, and finally the patient did. It's a finicky test to do. It has to be put in a special container. It has to be put in a special solution. It's got to be kept at a special temperature. It's got to be shipped to St. Louis, and it's not an easy test to do.
Well, thank you for that closing remark, and I will see you. I will be taking lots of pictures at the meeting, getting information
Okay.
from our families, and let's just hope that the Pro continues to just make a difference in the lives of all these families. I know you've been eagerly awaiting it, and without your dynamic cooling, I bet 70% of the patients wouldn't be getting laser because that's what's brought the comfort and that's what's reduced the pain by probably 70%, I would say.
Well, it's a hard number to quantify, but definitely the Pro Candela, to their credit, spent a lot more time, considering the development of the cooling technology in conjunction with the laser. It's not just spraying away. There's a whole, you know, you know, field of, spraying dynamics. What's the droplet size? What's the velocity? What's the area of the coverage? What's the heat flux off the surface of the skin? And they spent a lot more time, evaluating all of those different parameters before they released the Pro. And I think that's the reason why it's so much less painful.
And all I said was more clearance, less pain. That's what the families want. And
That's
that's what
right.
you're getting with the Pro. So hallelujah. Thank you, Dr. Nelson. See you soon. Come back next month on May 15th, our International Day of Awareness. We have two special guests joining us to talk also about some new treatment dynamics with port wine stains. So thank you all. Thank you, Dr. Nelson. Continue
be with you.
work. Take care.